Staker here with Westside-Medical. Today we're going to talk about stuff you can do at home for Baker cyst. Now Baker cyst is where you have swelling in the knee that over time actually protrudes out behind the knee, and it's called Baker cyst. That's just a fancy $10 word for it. So what happens is what causes the actual Baker cyst is an individual can have arthritis in their knee, or perhaps some kind of meniscus injury that causes that constant chronic inflammation. And you have a synovial capsule here, which is a capsule that holds in all that fluid in the joint. So you have that constant inflammation. Like I said, over time, you're going to get a bulge out behind that knee, and that can cause pain and certain issues. So what we do for it in the office, you take a compression band, and you also need like some kind of therapy band like this. You can get them at Westside Barbell. The whole rationale is we want to compress that joint. When you compress that joint and do high rep exercises, it's going to push that swelling back into your lymphatic system. The lymphatic system is what drains the inflammation. So first, the setup here is take a compression band. You can get a compression band, or you can get a piece of like tire tubing, something that's going to wrap around the joint. You're going to start below the knee. You're going to wrap towards the heart. You're going to overlap it about half an inch. It's like this. And this is the compression that's compressing that Baker cyst in the back of the knee. And the compression is going to push that fluid back in the circulation to help reduce it. Now this exercise is something you'll probably have to do on a regular basis, because you're going to keep getting swelling back there, but this will help reduce it. So you overlap it, make sure you wrap it towards your heart. So that pressure there is compressing my joint. I wrapped it probably about 50 to 60% tension, just enough to cause compression through there. Now we're going to do some high rep, they're called terminal knee extensions. So you're just going to put your foot here like this. You get tension in that band, and you're just going to straighten this leg. And that's going to cause contraction in the knee musculature. So you're contracting those muscles, and you have that compression, and that's just constant motion there is going to help squeeze that cyst back there and get that swelling out of it. So in my office, we do about 3 sets of 30 this direction here. So make sure you squeeze your foot in the floor and just extend your knee, and that's working the front leg musculature. So once again, you do 3 sets of 30. Then we have the patient turn around, and we go the other direction. This works more of the back leg, the hamstring. So once again, squeeze your foot into the floor. It's going to bend the knee just like this, and just pull it. Once again, it's just pumping those muscles through there, compressing that cyst and helping